Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's fourth lecture on systemic pathology. Today, day 2 of diseases of stomach. Day 2 of diseases of stomach. Dear audience, in day 1 of diseases of stomach, I have narrated about peptic ulcer and gastric ulcer briefly. Today, gastric carcinoma. Dear audience, we know carcinoma is the malignant neoplasm of epithelial tissue. So, gastric carcinoma is a malignant neoplasm of epithelial cells within the stomach. Before going to discuss about gastric carcinoma, we have to recapitulate about the different types of tumor that may occur in stomach. Now come to tumors of stomach. Dear audience, suppose this is the stomach. What are the different types of tumors that may occur within the stomach? Tumor may be benign tumors, among the benign tumors there may be adenoma, and adenoma may be tubular adenoma and villus adenoma. Villus adenoma. So adenoma may be tubular adenoma, villus adenoma. Stromal cell tumor. The stromal cell tumors may be leiomyoma, schwannoma, neurofibroma. So, stromal cell tumors that are benign may be leiomyoma, schwannoma, neurofibroma. Malignant tumors. The malignant tumors of the stomach may be gastric carcinoma, gastric lymphoma, gastric carcinoid. Another malignant tumor of the stomach is GIST, gastrointestinal stromal tumor. Malignant gastrointestinal stromal tumor such as leiomyosarcoma. These are the malignant tumors of the stomach: gastric carcinoma, gastric lymphoma, gastric carcinoid, gastrointestinal stromal tumor such as leiomyosarcoma. These are the different tumors that may occur in the stomach. Now come to gastric carcinoma. Gastric carcinoma. Dear audience, we have to know what are the predisposing factors associated with gastric carcinoma. predisposing factors of gastric carcinoma. Predisposing factors: age, race, dietary factors, pre-existing diseases of stomach, genetic factors. So the predisposing factors of gastric carcinoma: age of individual, race, dietary factors, pre-existing disease of stomach, genetic factors. Now come to age. Gastric carcinoma is common in middle age group. Common in middle age. Race, gastric carcinoma is common among the blacks and among the individuals who have blood group A. Common among the blacks and the individuals with blood group A. Now come to dietary factors. Dietary factors are very important for gastric carcinoma. High intake of salt, high intake of nitrates and nitrites, high intake of complex carbohydrate, high intake of complex carbohydrate. Low intake of green leafy vegetables, low intake of animal fat and protein, low intake of animal fat and protein. Dear audience, high intake of salt, high intake of nitrates and nitrites, high intake of complex carbohydrate, low intake of green leafy vegetables, low intake of animal fat and protein, all are associated with gastric carcinoma. All are the predisposing factors of gastric carcinoma. Now come to pre-existing disease of stomach. Pre-existing diseases of stomach associated with gastric carcinoma. One is chronic atrophic gastritis, partial gastrectomy. These are associated with gastric carcinoma. Dear audience, now come to pathogenesis of gastric carcinoma. Before going to discuss about pathogenesis of gastric carcinoma, we want to recapitulate about the gastric acidity. You know, gastric juice is acidic, and this hydrochloric acid of stomach is associated with many roles. One of the role of hydrochloric acid of the stomach or acidity of the stomach, it kills the bacteria that we ingest. It kills the bacteria that we ingest. It is the important role of hydrochloric acid of the stomach. Pathogenesis of gastric carcinoma. If anybody is accustomed with high intake of salt regularly, due to intake of salt, the pH of gastric juice will be increased. Again, if anybody suffers from chronic atrophic gastritis, there will be decreased hydrochloric acid secretion from the oxygenatic cell of the gastric gland. Again, there will be increased pH of the gastric juice. And if there is partial gastrectomy, there will be reduction of gastric mucosa. So gastric acid secretion of hydrochloric acid will be diminished. So there will be increased pH of the gastric juice. When there is increased pH of gastric juice, there is growth of Helicobacter pylori. Helicobacter pylori is a bacteria and it is carcinogen. High intake of salt, increased pH of gastric juice. Chronic atrophic gastritis. Is associated with decreased hydrochloric acid secretion. Due to decreased hydrochloric acid secretion, there will be increased pH of the gastric juice. Partial gastrectomy. Partial gastrectomy is associated with reduction of gastric mucosa. So there is decreased hydrochloric acid secretion. Decreased hydrochloric acid secretion. Due to decreased hydrochloric acid secretion, increased pH of gastric juice. Increased pH of gastric juice. Dear audience, high intake of salt, increased pH of gastric juice. Chronic atrophic gastritis, increased pH of gastric juice. Partial gastrectomy, increased pH of gastric juice. This increased pH of gastric juice is associated with growth of Helicobacter pylori in the stomach. Increased pH of gastric juice, that is decreased acidity in stomach. Due to decreased acidity in stomach, growth of Helicobacter pylori. Helicobacter pylori. And this Helicobacter pylori converts nitrates and nitrites to nitrosamine. Conversion of nitrate and nitrites to nitrosamine by Helicobacter pylori. And this nitrosamine is a carcinogen and it causes carcinogenesis. And as there is carcinogenesis, there is gastric carcinoma. Again, reduction of acidity in stomach following high intake of salt, following chronic atrophic gastritis, or following partial gastrectomy. There is growth of Helicobacter pylori in the stomach, and this Helicobacter pylori converts nitrate and nitrites to nitrosamine. Nitrosamine is a carcinogen, so there is carcinogenesis and there is gastric carcinoma. This is the pathogenesis of gastric carcinoma briefly. Dear audience, now come to Lawrence classification of gastric carcinoma. It is histoclinical classification. It is histoclinical classification given by scientist Lawrence. Two types of gastric carcinoma. One is intestinal type gastric carcinoma. Another is diffuse infiltrative type gastric carcinoma. Diffuse infiltrative type gastric carcinoma. Lawrence classification, it is histoclinical classification. Two types of gastric carcinoma, one is intestinal type, another is diffuse infiltrative type of gastric carcinoma. Now come to intestinal type of gastric carcinoma. Intestinal type of gastric carcinoma is an expanding gastric carcinoma. It is expanding gastric carcinoma. Dear audience, if this is esophagus and this is the stomach, and if this is the gastric mucosa, intestinal type of gastric carcinoma is expanding type. So if this is the gastric carcinoma, it will expand like this. It will expand like this. This is expanding type of gastric carcinoma. Chronic gastritis is associated with such type gastric carcinoma. It means if anybody suffers from chronic atrophic gastritis, it may lead to gastric carcinoma and it is intestinal type. if chronic gastritis is associated with gastric carcinoma, initially there is intestinal metaplasia in stomach. Dear audience, if chronic atrophic gastritis is associated with such intestinal type of gastric carcinoma, initially there will be intestinal metaplasia in the stomach, and from this intestinal metaplasia there will be gastric carcinoma. Intestinal metaplasia in stomach, then carcinoma of stomach. Again, if such type of gastric carcinoma is associated with chronic atrophic gastritis, initially there is metaplasia. What type of metaplasia? Intestinal metaplasia. And this metaplasia may turn to gastric carcinoma. Prognosis of intestinal type of carcinoma is better. Prognosis of intestinal type is better than diffuse infiltrative type. We are talking about Lawrence classification of gastric carcinoma. It is histoclinical classification. Now come to diffuse infiltrative type of gastric carcinoma. Diffuse infiltrative type, it is diffusely infiltrative type carcinoma of the stomach. It is not expanding, rather it is infiltrative in the wall of the stomach. Environmental influences are associated with such type of gastric carcinoma. Environmental influences are associated with such type gastric carcinoma. Dear audience, in case of intestinal type, chronic gastritis, chronic atrophic gastritis is associated with carcinoma, but in case of diffuse infiltrative type, environmental influences are associated with such type of carcinoma. Prognosis of diffusely infiltrative gastric carcinoma is worse. This is the Lawrence classification. This is histoclinical classification of gastric carcinoma. If this is stomach, this is stomach. In case of intestinal type of gastric carcinoma, it will be expanding like this. And in case of infiltrative type of carcinoma, it will infiltrate the wall of the stomach. This is intestinal type and this is infiltrative type of gastric carcinoma. Dear audience, now come to morphology of gastric carcinoma. Morphology of gastric carcinoma. First come to cross examination. Cross examination of gastric carcinoma reveals polypoid mass. Dear audience, you know tongue-like or finger-like projection from the mucosa is known as polyp. So grossly, gastric carcinoma may be polypoid. If this is stomach, if this is the wall of the stomach, the mass may be polypoid like this. This is the polypoid gastric carcinoma. It may be ulcerative. The surface of the gastric carcinoma is ulcerated. This is called ulcerative type of gastric carcinoma. Dear audience, why ulceration? I have told you previously, due to expansion of the carcinoma, there is a stressing on the surface of the carcinoma. Due to stressing, there is compression of the blood vessels. Due to compression of the blood vessels, there is ischemia. Due to ischemia, there is ulceration. It may be fungating type. The gastric carcinoma may be excavated type. Excavated type. Suppose this is stomach and this is the wall of stomach. Suppose this is the carcinoma of the stomach and it is excavated. This is the excavation. This is excavated type of gastric carcinoma. The gastric carcinoma grossly may be infiltrative type. In case of infiltrative type of gastric carcinoma, the anaplastic cell infiltrates the stomach wall and the stomach wall becomes thick, and this thick stomach wall due to infiltration of gastric carcinoma is known as lenitus plastica or known as leather bottle stomach. Dear audience, suppose this is the stomach, and this is the wall of the stomach. If there is infiltrative type of gastric carcinoma, the anaplastic cells infiltrates the wall of the stomach, and due to infiltration in the wall of the stomach wall become thick due to infiltration of the anaplastic cells, and the stomach containing such thickened wall due to infiltration of anaplastic cells is known as lenitus plastica. Lenitus plastica, or it is called leather bottle stomach. Leather bottle stomach. This is the cross examination of gastric carcinoma. Now come to histopathology of gastric carcinoma. Histopathology of gastric carcinoma reveals malignant cells arranged as well-formed gland or arranged as islands or groups. Anaplastic cells, that is malignant cells, are arranged as well-formed glands or as islands or as groups. Dear audience, anaplastic cells arranged as well-formed glands or arranged as islands or arranged as groups. These are the anaplastic cells showing glandular differentiation and arranged as well-formed glands. Or the anaplastic cells may arranged as groups. These are the anaplastic cells arranged as groups. Sometimes signet ring cell is found. Sometimes signet ring cells found histopathologically. Signet ring. If this is the anaplastic cell containing nucleus at the periphery due to presence of mucin. If this is the anaplastic cell and this is the nucleus, accumulated mucin in the cell pushes the nucleus at the periphery and the cell looks like signet ring. This is called signet ring cell. It may be found in gastric carcinoma when there is pushing of nucleus by accumulated mucin in the cell. Anaplastic cells may invade the gastric wall. So, histopathology reveals anaplastic cells arranged as well-formed glands or as islands or as groups. Sometimes signet ring cell may be found, pushing of nucleus at the periphery due to accumulated mucin in the cytoplasm of cell. And sometimes there may be infiltration of the gastric wall by anaplastic cells. This is the histopathology of gastric carcinoma. Now come to metastasis of gastric carcinoma. Dear audience, if this is the stomach and this is the gastric carcinoma here, where the gastric carcinoma may metastasize. Gastric carcinoma may metastasize to regional lymph nodes, may metastasize to liver, lung, peritoneum. If gastric carcinoma metastasizes to peritoneum, it metastasizes in the peritoneum as peritoneal seedings. So in peritoneum, it metastasizes as peritoneal seedings. This carcinoma of stomach may metastasize through the peritoneal cavity in case of female on the surface of ovary. Again, gastric carcinoma may metastasize through the peritoneal cavity on the surface of the ovary in case of female. And this is called Krukenberg tumor on the surface of the ovary, as per name of scientist Krukenberg. Through peritoneal cavity metastasizes to ovary, and this is called Krukenberg tumor. Again, gastric carcinoma may metastasize to regional lymph nodes, to liver, to lungs, and to peritoneum as peritoneal seedings. It may metastasize through the peritoneal cavity on the surface of ovary in case of female, and this is known as Krukenberg tumor in the ovary. This is all about the metastasis of gastric carcinoma briefly. Dear audience, today I have told you about the different types of tumor in the stomach. There is benign tumor and malignant tumor. Benign tumors, adenoma, may be tubular adenoma, villus adenoma. Stromal cell tumor may be leiomyoma, schwannoma, neurofibroma. Malignant neoplasms, gastric carcinoma, gastric lymphoma, gastric carcinoid, and gastrointestinal stromal tumor such as leiomyosarcoma. I have told you gastric carcinoma. There are some predisposing factors. Age, usually it occurs in middle age. Race, blacks are commonly affected by gastric carcinoma, and the individuals with blood group A are very much prone to develop gastric carcinoma. There are some dietary factors: high intake of salt, high intake of nitrates and nitrites, high intake of complex carbohydrate, low intake of leafy green vegetables, low intake of animal fat and protein. And I have told you dietary factor is very important for gastric carcinoma. Besides this, there are some pre-existing diseases of stomach like chronic atrophic gastritis, partial gastrectomy. Besides this, there is genetic predispositions. I have told you about the pathogenesis. Whatever may be the predisposing factors, if there is decreased acidity of the stomach, as in high intake of salt due to partial gastrectomy or due to chronic atrophic gastritis, it provides a soil for the growth of Helicobacter pylori, and you know Helicobacter pylori is a bacteria. It is carcinogen. It converts the nitrate and nitrites to nitrosamine, and nitrosamine is one of the chemical carcinogen, and it causes carcinogenesis, and there is gastric carcinoma. I have told you Lawrence classification of gastric carcinoma. It is histoclinical type, it is intestinal type, and diffuse infiltrative type. Intestinal type, it is associated with chronic gastritis, and before carcinogenesis there is intestinal metaplasia, and this metaplasia may turn to malignancy. The prognosis of intestinal type is a bit better, and it is expanding type of the gastric carcinoma. Diffusely infiltrative type, it is infiltrative type. Prognosis is worse, and environmental factors are associated with this diffuse type of gastric carcinoma. I have told you about the morphology. Grossly, it may be polypoid, ulcerative, fungating, infiltrative, excavated type. If we do histopathology, it will reveal anaplastic cells arranged as well-formed glands or arranged as islands or groups. Sometimes it may infiltrate in the wall of the stomach. It is called infiltrative type of adenocarcinoma. And sometimes we can get signet ring cell. Due to accumulation of mucin in the cell, the nucleus of the cell is pushed to the periphery and the cell looks like signet ring. I have told you about the metastasis of the gastric carcinoma to regional lymph nodes, liver, lung, peritoneum, on the ovary. Among the regional lymph nodes, in case of gastric carcinoma, if it metastasizes, we can get Barker's gland or Schleny lymph node. Dear audience, today up to this, thanks all.